Hello, medicos. Good day to all of you. This is Dr. BK for you, and today I am going to discuss about the back of the neck. With respect to the back of the neck, our learning objectives for today will be on mainly the superficial muscles of the back of the neck, then the deep muscles. They mainly comprise the erector spinae group of muscles, okay, so which mainly maintain the posture. These muscles, we are going to have a short look about these muscles, not in detail, and in detail we are going to actually discuss about the suboccipital muscles, and then the suboccipital triangle, which is present in a more deeper plane. So its boundaries and contents we will be discussing today. Now first structure which we would like to see is the ligamentum nuchae. So the ligamentum nuchae is actually a fibrous structure. It is triangular in shape with a posterior free border. An anterior border is attached to the spines of all the cervical vertebra and also extends to the external occipital crust and the external occipital protuberance. It divides the structures into two halves. At the back of the neck, the ligamentum nuchae is present in the posterior midline and divides the structures into both sides, right and left, and it is considered as the upward extension of the supraspinous ligament. Okay, so the ligaments between your spines is actually called as the supraspinous ligaments. There are various ligaments which are connecting your vertebra. Intervertebral joints are held together by the supraspinous ligament, anterior longitudinal ligament, posterior longitudinal ligament, and so on. Okay, so these ligaments, one of these ligaments which lies on top of the spine is the supraspinous ligament, and which continues above to the skull as the ligamentum nuchae. So it attachments, I told you, it is attached to the spines of the cervical vertebra, and also it extends to the external occipital crust and the external occipital protuberance up to the superior nuchal line, because the lateral continuation of the external occipital protuberance is the superior nuchal line. Now we will actually discuss, or let us see, the layers of the muscles of the back of the neck. Now superficial group, mainly you come across the trapezius muscle. So the trapezius muscle I have discussed in detail with respect to the upper limb muscles of the back. Okay, so the trapezius muscle is the superficial most muscle, and it is attached to the spines, originates from the ligamentum nuchae and spines of the cervical vertebra, and getting inserted mainly into the scapula. So the spine of scapula and medial border of the acromion process. So it is actually a muscle of the upper limb, and it is supplied by the ventral division of the cervical nerve C3, C4. Apart from that, its main motor nerve supply is the 11th cranial nerve or the spinal accessory nerve. Then deep to the trapezius, you see the levator scapulae, and then your rhomboids muscle, rhomboides minor and rhomboides major. So these muscles mainly anchor your upper limb to the vertebral column. Rhomboides major and minor retract the scapula, and this is your levator scapulae muscle arising from the superior angle of the scapula. Okay, so they are all supplied by the ventral division of the cervical nerves. So they have migrated mainly, but they carry along with them the their nerve supply, even though they have actually come to the posterior aspect. So in the superficial layer we have seen mainly the trapezius, then we have seen the levator scapulae, And then we have seen the rhomboidus major and the rhomboidus minor. The next muscle you see the upper part of the thorax and the neck intermediate group, the serratus posterior superior. So the serratus posterior superior extending from your posterior part of the ribs again to your vertebral column. They are more of the respiratory muscles. They act on the ribs. So naturally they are respiratory muscles. The serratus posterior superior and more lower down, the lower part of the thorax, you see the serratus posterior inferior. Now deep to the serratus posterior superior only, you can see the erector spinae group of muscles. But before that, apart from the serratus posterior superior, we have the next muscle, that is your splenius capitis and cervicis. Okay, so the splenius capitis and the cervicis, which we are seeing now. So the splenius capitis and cervicis come under the deep group of muscles. The splenius capitis and cervicis, they actually come under the deep group and intrinsic muscles of the back. From here onwards, these muscles, layer by layer, it will be supplied by the dorsal ramus of the cervical nerves. So you know each spinal nerve divides into a ventral ramus and dorsal ramus. Okay. So the ventral ramus passes to the front, supplies the muscles and also takes part in the plexus, your cervical plexus and the brachial plexus. Whereas the dorsal muscles, they divide into medial and lateral branch, of which only one is cutaneous. Either the medial branch will become cutaneous or the lateral branch will become cutaneous. The upper part, it is the medial branch, and in the lower cervical segments, it is the lateral part, lateral branch, which becomes the cutaneous. Okay, and the first cervical does not have a cutaneous branch. The first cervical nerve, the dorsal ramus of the first cervical nerve. So first layer, we are able to see the splenius muscles, which is called as the splenius capitis and then the splenius cervicis. Then deep to that, we will come across the longissimus group of muscles. Okay, and then deep to that, you come across the oblique group of muscles. They are obliquely oriented, but they come under the spinalis group. Longissimus group on top of it, and more superficial to it is the splenius group of muscles. Now coming to these two muscles, splenius capitis and cervicis. As I told you, the splenius capitis is the first layer. Then deep to it, what you see is the longissimus group of muscles. Longissimus capitis and longissimus cervicis, deep to it. Okay. Now, the splenius capitis, actually from where it arises, deep to the trapezius, it is seen and it forms the floor of the posterior triangle. It forms the floor of posterior triangle. So naturally, it will get inserted into the mastoid process and the superior nuchal line. It inserts into the mastoid process and superior nuchal line. So origin is from the spines, upper thoracic spines. Okay, from the upper thoracic spines. Whereas the splenius cervicis muscle, the splenius cervicis muscle lies deep to the levator scapulae muscle. It actually lies deep to the levator scapulae muscle and it is inserted into the transverse process of upper four cervical vertebra. It's going more lateral and getting inserted into the transverse process of upper four cervical vertebra. That is your splenius cervicis and this is your splenius capitis. Splenium means, some people call it as a rounded, or some they tell it is hemispherical in nature. They form like a bandage over the deep group of muscles. Okay, that is about the splenius capitis and the splenius cervicis. The next muscle, before that, here you are able to see a dissection image of the splenius capitis going to the mastoid process and lateral part of the superior nuchal line. And this is your splenius cervicis. attaching to the transverse process, posterior tubercle of the transverse process of upper four cervical vertebra. Okay, so that is the splenius capitis and cervicis. The next group of muscles which we are going to discuss in the deep group, it is the intermediate layer. First we saw the splenius capitis as the superior layer. Now we are going to see the intermediate layer. The original erector spinae group of muscles, they come under the sacrospinalis group, starting from the sacrum. But when they reach the thoracic part, okay, they divide into three groups: the medial, intermediate, and the lateral group. Okay, from medial to lateral, they can be seen as the three groups. The more lateral one is actually called as the iliocostalis. Okay, the three columns, the lateral column is actually called as the iliocostalis muscle. Okay, then the intermediate group is actually called as the longissimus muscle. The more lateral is the iliocostalis. Then the intermediate group is actually called as the longissimus, which mainly consists of your longissimus cervicis and the capitis. All this I am speaking with respect to the neck, because lower part you also have longissimus thoracis also. Okay, so this muscle actually takes a U-shaped origin in the lower part, and it overlaps the deeper group of muscles, that is the multifidus muscle. Okay, that is the multifidus muscle. The longissimus cervicis muscle, which you are seeing here, arises from the transverse process of the upper four thoracic vertebra. Upper four thoracic vertebra. Okay, longissimus thoracis, upper four thoracic vertebra, and inserts into the transverse process of the C2 to C6 vertebra. So it is like a relay muscles. These muscles, what happens is, once it inserts, the next group, a higher group will start from medial to it, then medial to it. So like that, longissimus thoracis, longissimus cervicis, and longissimus capitis, it goes on. So longissimus cervicis, so this is your longissimus cervicis muscle. It arises from the transverse process of the upper four thoracic and gets inserted into the transverse process of the C2 to C6 or C6 to C2 muscles. Longissimus capitis is actually medial to the insertion of the preceding. As I told you, like a relay they run, and they actually, what happens is, goes and gets inserted into the mastoid process, deep to the splenius capitis and sternomastoid. So longissimus capitis is present deep to the splenius capitis and the sternomastoid. Longissimus capitis is thought to be the one of the erector spinae group getting directly attached to the skull, gaining direct attachment to the skull. So that is about the intermediate column, longissimus group. Lateral column is the iliocostalis group. We have only iliocostalis cervicis, we don't have the upper part. Iliocostalis capitis is not there as such. Okay, so the next, as we have seen, is the longissimus capitis muscle, which is getting inserted into the mastoid process deep to the sternocleidomastoid and the splenius capitis. So this is your longissimus muscle, which you are able to see here. This is your longissimus capitis and the longissimus cervicis. Longissimus cervicis and the longissimus capitis, like a relay, where the end, where the lower part ends, the upper part starts medial to it and then goes above. That is the longissimus cervicis and capitis for you. The next muscle, the medial group of muscles which we are going to discuss, is about the semispinalis group of muscles. Spinalis, they are called as collectively. Now, it consists of number of oblique, they are actually oblique, Now longissimus, actually what happens, they are actually long and vertical. The next muscle comes under the oblique group of muscles. They extend from the transverse process to the spines and they are arranged as semi-spinalis, which we are going to see. Deep to that you have multifeeders and rotators. Okay. The semi-spinalis group of muscles, capitis, long thick muscle which you are able to see, and it produces the bulge on either side. In the midline you see a furrow where the ligamentum UK is attached. On either side this bulge is mainly produced by this semi-spinalis muscle, and it will be overlapped partially by the splenius capitis. Okay, and deep to it only you have the suboccipital triangle. Okay, deep to it only you have the suboccipital triangle. It arises from the articular process. The splenius capitis muscle actually arises from the semi-spinalis capitis muscle arises from the articular process of the lower cervical and from the upper thoracic vertebra. So it is from T4 to C3 and it is inserted into the area between the superior and inferior buccal line. Area between the superior and inferior buccal line, the medial part to the occipital bone, it is attached. The semi-spinalis capitis muscle. So from the transverse and the articular process, semi-spinalis capitis. Okay, and I told you it lies deep to the splenius capitis. Deepest group multifidus interspinalis and the intertransversi. Now why actually semi-spinalis is named so? Because it is again seen only the upper part of your spine or your vertebral column. Lower part, the semi-spinalis, is again absent. Then short muscles, these are multifidus muscles. Deep to the semi-spinalis they are present. And then you have the rotators group of muscles. So they are the deepest group of the multifidus. They actually cross from one vertebra to the other, from the root of one transverse process to the other spinous process. Then other group of muscles you have interspinalis, intertransversi and so on. So mainly, what is the main function of these muscles? The erector group of muscles, the short muscles, they are postural muscles, helps maintain your posture because the gravity passes in front of your vertebra. They help to keep your neck and head in an extended position. Okay, so that is why they are actually called as the postural muscles. Chief extensors are the erector spinae group and assisted by the splenius and the semi-spinalis capitis. Okay, so what we have seen that longissimus capitis, longissimus cervicis and your semi-spinalis capitis assisted by the splenius capitis. Now, sternocleidomastoid along with the splenius and semi-spinalis are the chief rotators of your head. So, turning your head or face is mainly by your splenius, semi-spinalis and your sternomastoid muscle. Okay, they are the chief rotators of the head. Whereas the multifidus, the more deep group we have seen, rotates your trunk muscles. Then, if your spleniae bilaterally contract, both the spleniae contract, then actually they extend your head, and in unilateral contraction, they produce the lateral flexion. They draw the head and the face to the same side. Okay, so all these actions we have seen along the actions of the sternocleidomastoid. The sternocleidomastoid muscle, we have seen these actions. So these all act in concert with each other, especially that is why sternocleidomastoid assisted by your semi-spinalis and splenius capitis. Lateral flexion of the head and face to the same side. So next, we will pass on to the suboccipital region. So more deep to the semi-spinalis group of muscles, semi-spinalis capitis. we have the suboccipital region. What are the boundaries of suboccipital region? Above, it is limited by the superior nuchal line. Okay, above it is limited by the inferior nuchal line. Below and medially or apex, you can tell it is by the massive bifid spine of the axis. Okay, the spine, massive bifid spine of the axis forms your lower boundary or below, and laterally it is actually formed by the transverse process of C1, C2 and the mastoid process. Okay, so from above downwards it is mastoid process and transverse process of C1 and C2. So these are the boundaries of the suboccipital region. Okay, mastoid process C1, C2 forming the lateral boundary. Above or base, you can tell, is by the inferior nuchal line, and below or apex is by the spine of the axis. Okay. Now, what does this suboccipital region contains? Mainly your suboccipital muscles. 4 muscles are considered as suboccipital muscles. They are obliquus capitis superior, obliquus capitis inferior, rectus capitis posterior major, and then rectus capitis posterior minor. So these 4 muscles are actually considered as the suboccipital muscles. So we will try to understand these muscles one by one. Now, first muscle which we are going to see is the obliquus capitis inferior muscle. So this is the obliquus capitis inferior muscle. So it extends upwards and laterally from the spine of axis to the transverse process of atlas. Okay, spine of axis to the transverse process of atlas. Now, these muscles, mainly your suboccipital muscles, they are acting on your atlantoaxial joint. So this muscle, by its pull, what happens is it rotates the atlantoaxial joint, the joint between the C1 and C2 vertebra, so that it turns the face to your same side. Okay, so you all need so many muscles because the weight of the head is actually borne by your cervical vertebra. So all the muscles are anchoring so that it maintains the posture, and at the same time it also brings about the desired or the required movement. Obliquus capitis superior. Sorry, this is obliquus capitis inferior muscle, which you have seen from the spine of the axis to the transverse process of the atlas, acts on the atlantoaxial joint. The next muscle which you are able to see on this side is your obliquus capitis superior muscle. Okay, so the obliquus capitis superior muscle from the transverse process of atlas and goes to the attaches to the skull between the superior and inferior nuchal line, where actually the semispinalis capitis is attached, but lateral to it. Okay, it attaches lateral to the semispinalis capitis in the area between the superior and inferior nuchal line. So that is about the obliquus capitis superior muscle. This is extends the skull and also produces lateral flexion. Okay. So mainly inferior rotates the head to the same side, as I told you, acting on the atlantoaxial joint. Both the muscles, they extend the head. The next muscle which you are going to see is the rectus capitis posterior major. Rectus capitis posterior major arises from the spine of axis, again from where the obliquus capitis inferior arises. It passes upwards and laterally. And inserts into the lateral part of the inferior nuchal line. Okay, so it inserts into the lateral part of inferior nuchal line and an area of bone below the line. So that is about the rectus capitis posterior major muscle. Rectus capitis posterior major. This muscle you are seeing. The next muscle is a rectus capitis posterior minor from the posterior tubercle of atlas. This is the only muscle which is arising from the atlas bone. Posterior tubercle of atlas inserts into the medial part of the inferior buccal line. Okay, so actually what happens is it is occupying a small area between the diverging muscle fibers of the rectus capitis posterior major. Okay, rectus capitis posterior minor and major. Major occupies the lateral part of inferior buccal line, minor occupies the medial part of the inferior buccal line. So their main function is actually extends the head, and all four muscles are actually supplied by the suboccipital nerve or the dorsal ramus of C1 nerve. Now, apart from that, if you look the spine of the C2 vertebra axis is massive and gives attachment to 5 pairs of muscles. Rectus capitis posterior major, pair of rectus capitis posterior major, pair of obliquus capitis inferior, and a pair of the semispinalis cervicis and multifidus and rotators. Whereas posterior tubercle of the atlas, because the spine of atlas itself is completely reduced, it gives attachment only to the rectus capitis posterior minor. So that is about the suboccipital muscles. They help in extension of the head as well as the act on the atlantoaxial joint in lateral rotation or turning the face to the same side. So now coming to the suboccipital triangle, which is actually present in between the suboccipital muscles. So boundaries, mainly it is formed superomedially by rectus capitis posterior major. Rectus capitis posterior major. Okay, superomedially. Then superolaterally it is formed by the obliquus capitis superior. Obliquus capitis superior. Inferior is formed by the obliquus capitis inferior. Rectus capitis posterior major supplemented by minor. Superolaterally it is the obliquus capitis superior, and inferiorly it is the obliquus capitis inferior. So mainly it contains the third part of vertebral artery and the dorsal ramus of C1 nerve. Third part of vertebral artery and the dorsal ramus of the C1 nerve. Okay, and also suboccipital plexus of veins. So it is actually the plexus of veins is also situated there, which is called as the suboccipital plexus of the veins. Now, what forms the roof and floor of the suboccipital triangle? Roof, I told you, the triangle itself is deep to the semispinalis capitis muscle. Okay, and then medially you have the longissimus capitis. These two muscles are separated from the triangle by a dense fibrous tissue. Okay, they are separated from the muscles by a dense fibrous tissue. So dense fibrous tissue, at top of it what you have is the splenius capitis and the longissimus capitis laterally. Splenius is medial. Floor is formed by atlanto-occipital membrane. Okay, the floor is actually formed by the atlanto-occipital membrane and posterior arch of atlas. So this is the posterior arch of atlas, and the membrane which is extending is actually from the occipital bone to the atlas is the atlanto-occipital membrane. That forms the floor. Posterior arch of atlas and the atlanto-occipital membrane. Now, there is the lower border of the membrane shows a gap, and between the posterior arch of atlas and that lower border, arched lower border of the membrane, the vertebral artery enters and the C1 nerves emerges. This lower border sometimes might be ossified. The nerve is actually present between the arch of atlas and the artery. Okay. So here You are able to see the suboccipital triangle. So that is the suboccipital triangle which you are seeing, and arch of atlas, atlanto-occipital membrane, your third part of vertebral artery, and that is your C1 nerve, suboccipital nerve. Near the roof superolaterally, it is related to the occipital artery, and below you can see the greater occipital nerve winding around the lower border of the rectus obliquus capitis inferior. Okay, inferolaterally you can see the greater occipital nerve, and superolaterally it is related crossing the roof. It's the occipital artery. Okay. So now we will try to discuss the contents of the suboccipital triangle. So mainly, as I told you, C1 nerve, also called as the suboccipital nerve, the first cervical nerve, does not have a cutaneous branch. Mainly it is muscular. It immediately comes out and divides into 5 branches. It divides into the 5 branches. Now, the first cervical nerve along the lateral mass of atlas is divides into ventral and dorsal rami. The dorsal rami of C1 only is actually called as the suboccipital nerve. It emerges between the vertebral artery above and the arch of atlas below, and as I told you, it divides into the 5 branches. So these 5 branches mainly they supply the 5 muscles. Okay. So the 5 muscles are obliquus capitis superior and inferior, rectus capitis posterior major and minor, and then the semispinalis capitis. That is your suboccipital muscles, 4 muscles, and the semispinalis capitis it supplies. Not only that, if you actually look carefully, the branch to the obliquus capitis inferior will give a communicating branch to the greater occipital nerve. Okay, the branch to the obliquus capitis inferior will give a communicating branch to the greater occipital nerve. Okay, so that is about the first cervical nerve, dorsal ramus of first cervical nerve, called as the suboccipital nerve, and mainly, as I told you, it supplies the 5 muscles, 4 suboccipital muscles and 1 muscle on the roof, that is the semispinalis capitis, and maintains a communicating loop with the greater occipital nerve. The next structure which you come across is the greater occipital nerve, or the dorsal ramus of the C2 nerve. The dorsal ramus of C2 nerve is actually the greater occipital nerve. So it is considered as the thickest cutaneous nerve in the body and actually derived from the dorsal ramus of the C2. So in the last slide we have seen it curves around the lower border of the obliquus capitis inferior, receives a communication from the C1, from the branch of the obliquus capitis inferior, and then crosses the infromedial part of the roof. Then it pierces the semispinalis capitis and trapezius muscle, lateral to the ligamentum nuchae. Okay, pierces the trapezius muscle and then becomes cutaneous to supply the scalp. Okay, so it becomes cutaneous to supply the scalp. Thickest nerve pierces the semispinalis capitis and trapezius muscle. The next nerve, medially, what you are able to see is the third occipital nerve, medial branch of C3. So that is why third occipital nerve pierces the semispinalis capitis and the trapezius. It is present medial to the greater occipital nerve and supplies your back of neck, skin over the back of neck up to the external occipital protuberance. The terminal part of the superficial part of the greater occipital nerve accompanies the occipital artery. So it is present medial to the occipital artery. The next content which we are going to see is the vertebral artery. The main content is the C1 nerve, which we have already seen, and the next content is the vertebral artery, the third part. First of all, let us try to understand. Vertebral artery is a branch of subclavian artery. It is from the first part of the subclavian artery, seen in the scalenovertebral triangle. The first part is seen in the neck in the scalenovertebral triangle. From its origin up to it, where it enters into the foramen transversorium of C6 vertebra. The second part actually is a vertical part which passes through the foramen transversorium of C6 to C2 vertebra. So inside the foramen transversorium, you can see the vertebral artery actually traversing. Okay, then once it emerges out of the foramen transversorium of the C2 vertebra, it turns laterally, and there you can see in the suboccipital triangle. That is the third part. So third part of the artery you are actually seeing in the suboccipital triangle. So it is contained in the suboccipital triangle, and above you see the arched lower border of the atlanto-occipital membrane, and it lies on the posterior arch of the atlas. Okay, it actually lies on the posterior arch of the, and between the artery and the bone, what you have is the suboccipital nerve. Between the artery and the bone, you have the suboccipital nerve. Now, in this part, sometimes the arterial pulsations can be dampened. Okay, the arterial pulsations can be actually dampened. Then fourth part pierces the meninges and enters the brain through the foramen magnum, and enters the brain through the foramen magnum, and it will join with the fellow of the opposite side, vertebral artery of the opposite side, to form the basilar artery, and it gives mainly branches to your spinal cord, upper segment of the spinal cord through its anterior posterior spinal arteries, then to the brainstem and cerebellum, and also to the lower inferior, posterior inferior part of the cerebrum, to the posterior inferior part of the cerebrum it actually supplies. So that is about the vertebral artery. Okay, so first part, second part, and third part is the one which you are seeing in the suboccipital triangle. Then the next content what you come across is the occipital artery. It is a branch of external carotid artery. So you can see it is crossing the apex of the posterior triangle. Okay, and what happens is it lies successively after passing deep to the lower border of posterior belly of digastric or splenius capitis, longissimus capitis, and then lodges in the groove, mastoid groove, deep to the mastoid process. And as I told you, it crosses the apex of the posterior triangle. Then it becomes superficial by piercing the trapezius muscle and accompanies the greater occipital nerve. And actually, blood supply to the posterior part of the scalp. So it gives branches, mainly muscular branches, meningeal branches, and mastoid branch, and it also gives a descending branch. This descending branch, which actually superficial and deep to the splenius capitis, they form collateral circulation between the external carotid artery and or subclavian artery, divides into superficial and deep branch. Superficial branch and deep branch, they maintain connections with the transverse cervical and deep cervical arteries. Okay, so that is about the occipital artery. Suboccipital plexus of veins. So it is situated in and around the suboccipital triangle, mainly collects blood from the surrounding muscles, collects blood from the occipital vein, and also has communications through the transverse sinus. Via emissary vein, it actually communicates with the transverse sinus. Apart from occipital vein, emissary vein from transverse sinus has communication with the internal vertebral venous plexus and above also to the basilar plexus of veins. Finally, they drain into the vertebral vein. So actually, the suboccipital venous plexus drain via the vertebral vein. So here you are able to see the suboccipital venous plexus. Transverse sinus through emissary vein will have a communication. Inside the vertebral column, you have the intervertebral venous plexus that also maintains communication, and also with the basilar plexus of veins, and it will drain into the mainly into the vertebral veins. That is about the suboccipital plexus of veins. Now coming to the clinical aspects, suboccipital syndrome. So what is suboccipital syndrome? Pain, stiffness over the back of the neck due to the spasm of muscles, suboccipital muscles or neck muscles, mainly abnormal posture. Okay, so you are in an abnormal posture for a long time. Second thing, any underlying disease, mainly diseases of the spine or vertebra, like your spondylitis, okay, cervical spondylitis. So all those things can lead to suboccipital syndrome. Now, pain you experience in the posterior part of the head and neck, and it radiates to the side and the neck and back of the eye. Radiates to the side of the neck and back of the eye. So mainly the headache is a very generalized term. It can be due to many reasons. One is, as I told you, stiffness of muscles, back of neck, stiffness of muscles or underlying bone disease, or sometimes even pain in the eye can be referred to the occipital region, because there you have your primary visual and secondary visual areas. Then posterior part of your cranial cavity, meninges. So sometimes if there is an inflammation of meninges, meningitis, again pain is referred only to the back side. If it is the posterior part of the meninges or the any of the venous sinuses is affected. Okay, so mainly stiffness you can see in the, if it is a muscular pain, you see stiffness in the muscles. Suboccipital syndrome, which actually radiates to the side of the neck and back of the eye. The next is cisternal puncture. So subarachnoid cisterns. So there are certain places within your cranial cavity between the meninges. The CSF is there, the subarachnoid space. At certain places you have large collections of CSF, like cisterna magna, cisterna pontis, interpedicular cistern, and so on. The largest cistern is actually the pontomedullary cistern or the cisterna magna. You do a puncture to withdraw CSF for any diagnostic procedure, or you want to drain the CSF. Okay. So it is performed in the midline above the spine of axis. At what level? Nasion. You draw a line from the nasion passing through the external acoustic meatus. From the nasion to the external acoustic meatus, you draw a line. Along that line you can see you pierce a needle which has to pass 4 to 5 centimeter in depth. All the muscle layers you pierce, and you pierce the this atlanto-occipital membrane. Once you pierce the atlanto-occipital membrane, you feel the resistance has gone. Okay, so the resistance is no longer felt, and you should be very careful, because if you proceed further, you might actually damage the medulla oblongata, where the vital centers are present, your cardiac and respiratory centers. So if it is injured or stimulated, it might also prove fatal. So it is a very cautious procedure, only performed when there is no other option. So if lumbar puncture or anything cannot be done, this is the only option to be done to withdraw CSF, then only the cisternal puncture is actually advised. Otherwise, it is not usually advised. Okay. So that is all for today's class, and thank you very much for your patient listening.